TMJ pain related to a temporal mandibular disorder, dysfunction, can be very, very debilitating. Not only does it cause jaw pain, can cause clicking, popping, limited jaw opening, but it also causes a tremendous amount of emotional distress. I've seen many, many patients with TMJ pain and TMJ problems, and it's totally affecting their life. The good news is for TMJ pain sufferers is that there is conservative options for TMJ pain relief. And one of them is chiropractic adjustments of the jaw. Now, I'm not gonna talk about that in this video, but I did make a video about that and I'll post it into the description below and on the end screen at the end. It's how I do chiropractic adjustments of the jaw to help correct TMJ problems and relieve TMJ pain. I've had many, many patients come in with TMJ issues. We also look at the neck as a connection to that problem, but I've been able to adjust their jaw and improve their mechanics, their ability to open their jaw and reduce their pain, and then of course improve their quality of life. So in this video, I want to give you 4 great, easy to do self-massage techniques for the TMJ area to help relieve that TMJ pain. You can do this right at home. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift normally without pain and limitation. Why is that important? So you can do the things you want to do in life free of pain and discomfort. So if you want these tips and strategies, do subscribe right now by clicking on that red button below. Like this, you don't miss out on these videos that I put out on a weekly basis. Turn on the notification bell as well. And do tell me in the comments below, tell me I subscribe to your channel and I'll personally reply back with a thank you. So let's get into these self-massage techniques, and I'll give you 4. You can follow along, you can watch the entire segment first and then come back and try it yourself, or you can follow along as we proceed. Remember, if it's uncomfortable, don't do that. If you need to get clearance from your doctor or therapist, that might be a good idea too. So, massage technique number 1. These are release techniques. These are tension and soft tissue release techniques. We're going to work with the masseter muscle, which is often tender and inflamed when it comes to TMJ problems. So I'll switch to the side like this so you can see me. The masseter muscle is this bulky muscle on the side of the jaw, right over here. And you're going to do a stripping technique. We're going to do 2 directions. We're going to go up and then we're going to go down. And we're going to use a jaw opening at the same time. So the motion is like this. You're going to strip up, just like that. Dig in a little bit to your comfort and then strip up. Good. And you cross the TMJ joint. From the front, it'll look like this. You want to keep your jaw unclenched. Do not clench. So keep it loose. What you can do also is you can counter with a jaw opening, like this. I can feel the tension releasing as I do this. I'm digging in and moving up. I also like to do it in the downward direction as well, with the jaw opening. As you can see, it's hard to talk and do the exercise at the same time. So cope with me, okay? Good. I've done this already several times, even before I was shooting the video to practice, and this is feeling all nice and loose and released for me. Now, if there's lots of pain and inflammation, you might not be able to dig too deep, so keep it superficial. You can also ice the area for 5 or 10 minutes afterwards to kind of flush out the inflammatory byproducts that are in there as well. Okay, so that's number 1. Number 2, we're also going to work on the masseter muscle again. This time we're going to do a cross friction massage of the masseter muscle. So I'll turn to the side, okay? So if you can imagine the masseter muscle has fibers going this way, we're going to go just like that, cross friction, okay? Dig in and you're going to go across. You can use 1 finger or 2 fingers. I'm using 2 fingers. From top to bottom and bottom to top. Go from front to back as well. Okay, I'll switch. Okay, so that's a cross friction. You can go back to that stripping technique after the cross friction. Good, it's beginning to feel really good. TMJ massage release technique number 3. We're going to work on the temporalis muscle, which goes into the TMJ. So the temporalis muscle is on the skull here over the temple, and it goes into the TMJ. So we're going to, same idea as the masseter, we're going to put some pressure in. Okay, just start the TMJ joint. You can tell what that is by opening and feeling the motion of the joint. And you're going to go upwards. Just like that. Okay, from the front, it looks like this. Go right to the top, okay? You're going to mess up your hair as you do this. Totally fine. You can comb it later. If you're looking at repetitions, you can do as many as you feel comfortable. 10, 20, whatever is comfortable for you. Good, okay? Go down as well. Just like that. Good. Okay, you can do jaw opening at the same time. So you're pulling up as your counter opening, okay? Getting some good stripping into that temporalis muscle. You can also add a cross friction massage in here. Just like that. Okay, and there. Okay, awesome. Things are beginning to feel really loose in my jaw area. TMJ massage technique, muscle release technique number 4. Out of all these, this might be the most painful. The pterygoid muscle, the medial pterygoid muscle right underneath the mandible, underneath the jaw. Soon as I touch that or palpate that with a patient, with my thumb or finger, they're jumping off the table because it's so painful. So be careful. In this case, I don't want you to strip in there. I don't want you to do any cross friction massage. You can do some contact trigger point release. So sustained contact. Take your thumb, dig under, over here, under the mandible, underneath, behind. Find the trigger point. It's going to be tender. It's going to be painful. Press to your tolerance. Don't go too deep. Only to your tolerance. And you press until you feel a release, or either release in tension or release in pain. Okay? So just like that. There's a spot right there for me. Feels really good actually to release it. Hold it for about 10 seconds or until you feel a release. I feel a release right about now. You can let go. And then go a little lower. There's another spot right there. I'm going towards the ceiling, hooking it underneath the jaw. Holding until I feel a release. Either release of pain and discomfort or a muscle softening. Good. And as well, you do the same to the opposite side. Find that trigger right there. And then I'll go a little lower. Always towards your comfort, with your comfort and tolerance. And release. Good. So that's number 4. Now, again, I want to give you a word of caution. I don't have a TMJ issue. I don't have a TMD problem. Even if I don't have a problem, these muscles are tender. They're tight. We use our jaw all day long, thousands of times a day when you're eating, you're chewing. So you're using these muscles. So even if you don't have a TMJ problem, they're going to feel a little sore and tender when you do this. It's going to feel better afterwards. If you have a TMJ problem, it's going to be inflamed. You have to be extra cautious, okay? Do it to your tolerance. Just want to reiterate that because I know how tender these things are when I check them on our patients. And again, afterwards, you can place an ice pack on there, okay, somewhere around there for about 5 minutes, and that'll help relieve it. So these 4 self-massage techniques you can do at home can be very helpful to relieve tension and also pain in the TMJ area. Now, I've seen many people with severe, intense jaw pain, TMJ pain. So you need to be delicate and be cautious when you do these self-help massage techniques. If they're uncomfortable, if they're not tolerable, you can't do them, then just don't do them, okay? So you make sure that they're doable for you. As well, remember, these are an adjunctive approach to taking care of the TMJ. It may require other treatments like perhaps a chiropractic assessment and adjustment of the jaw, perhaps an assessment of your posture, especially the cervical spine. So do consider that as well. You can always look for a chiropractor that is trained and is knowledgeable on how to assess TMJ problems and adjust them accordingly.